Hi, everyone. I think we'll get started. So if you want to take a seat, find a seat where you can socially distant, to be physically distant, we'll get started. We're steaming up today here, so it's great to be outside. And can you believe this Atlantic bubble? Isn't this incredible that we are so lucky? Thank you to everyone, everybody in Nova Scotia for helping to make this Atlantic bubble a reality. So we're so honored. So welcome here. My name is Steve Harding. I'm the CEO of the Dartmouth General Hospital Foundation. I'll be your MC today, guiding you through this event. Welcome to our Transforming Access to Care launch, our celebration of our new partnership with the RBC Foundation and RBC to fund 5 new initiatives here at the Dartmouth General Hospital. You'll be hearing more about these initiatives today through the next 45 minutes. And I think you're going to be impressed with some of the amazing work that's happening thanks to this tremendous gift from RBC. While the Dartmouth General here, as you see behind us, is growing, projects like these that you'll hear about today are crucial to really driving that community involvement and continuing our strong community focus here at the Dartmouth General. Our Above and Beyond campaign, we're raising $13 million toward this $150 million project here at the Dartmouth General. So an amazing transformation by the province of Nova Scotia and Nova Scotia Health to really transform, creating state-of-the-art facilities here in our new hospital. But these new facilities mean nothing without strong community involvement and strong community engagement. And thanks to RBC, we're able to drive that additional focus within our community to help keep our community healthy and safe. I want to thank everyone for coming out today and want to say a special thank you to our campaign co-chairs. I'll ask them to stand up. So John Fitzpatrick from Boyne Clark. Thank you, John. Nope. Dr. Carla Pittman, our campaign co-chair as well. Fred Smithers will maybe joining us here shortly. You see Fred's name on the outside of the building as our celebrating his transformational gift with the Fred Smithers Center for Orthopedic Care. I also see Joe Diab in the crowd as well. So I saw Joe earlier, Joe and Violet. Joe is a key donor to the project as well, and also is the CEO of Baker Drive Developments. Thank you, Joe. I'm also happy to be joined here by Dr. Todd Howlett. So Todd, stand up and give a big wave. Chief of Staff of the Dartmouth General, now the interim medical director for all of Central Zone in Halifax. Todd had an amazing vision for this transformation and also for the support in the community. Also, Bruce Dello, our board chair, Bruce Dello, is joining us today. So thank you, Bruce, for joining us. Bruce is our board chair of the Dartmouth General Hospital Foundation, as well as Sharon Davis Murdoch, a member of the board of directors for the Dartmouth General Hospital Foundation. Stand up, Sharon, and wave. I see Dr. Chad Williams as well. So Chad, stand up as well, and one of our physicians here at the Dartmouth General. Thank you, Chad. So we have some housekeeping items to be aware of. Please, masks are mandatory today. We are able to do this thanks to strong physical distancing requirements by the province. So unless you're at the mic, so our speakers can remove their mask at the mic, I will wipe down the podium here after each speaker, just to make sure that the space is sanitized. So again, please wear your mask and please be physically distant, please. Please be advised also we're live streaming this event today. So people who couldn't be here in person, they'll be watching via live stream. Many of our RBC partners as well are watching remotely. And also this recording will be on the Dartmouth General Hospital Foundation website. So you'll be able to watch it again and again and again and watch it over and over. Okay, great. So we're going to start our celebration today with a blessing from Elder Eileen Brooks of the Sabanakadi First Nation. Eileen?
me back up. Hello, everyone. My name is Eileen Brooks. I'm from this unceded territory of the Mi'kmaq. Nindela was an Eilisi book. Niskamelu with them says as well, Alio. Nuchinin was away, but Jip to Delawis and make it any match was, so Dilly Don and Jip took ignorant, Delis Jip took out on Mammic, Kamic. Dilly McGibna go, let's me go up Nick, Niggaskis cook. Ba Nigginu and Ellen, and Dilly a big sickajik. Way Gwyn and it that mean, Dilly and guess the guardnagle. When Jick'll go away, I'll tickle out one not liage. I'm sitting on one spirit we walk. Hey.
Thank you so much, Eileen. That was very, very special. I'm now pleased to introduce the Iron Tide Singers to perform the honor song. Wow, incredible. Thank you very much. Let's give a round of applause there. Incredible. So the Iron Tide Singers, incredible. Thank you so much for an amazing performance. We are honored to have you join us here at the Dartmouth General. Thank you very much. Back on Friday the 13th, March 13th, remember way back on March 13th, the very beginning of the pandemic, it was an unlucky day for Friday the 13th. Dr. Todd Howlett came to my office and said, we need to really work hard to increase our outreach with our Indigenous communities, our patients in the Indigenous communities, and also our patients in African Nova Scotian patients in East Preston, North Preston, to really help them through this pandemic. Todd, you were bang on. You were clearly a visionary. And some of the projects we're talking about today are really a result of that conversation that Dr. Howlett had way back in March. It seems like ages ago that happened. One of the first people we reached out to was Trevor Sanapas. So Trevor has been a great colleague and great advisor and a key member of this the outreach program that we've been doing. I'd like to welcome Levi Marshall and Trevor Sanapas to the stage to talk about their new initiative on outreach. Thank you.
I'll just do the intro. You want to start with the...
Yeah, and then I'll use your thing for the first page.
All right. All right, thank you very much for that introduction. And we are so happy to be here with all of you today. And my name is Levi Marshall, for those of you who didn't already know that. The first thing I want to say is I think a key theme that has come out of the pandemic is community. You know, now we're relying more than ever on our neighbors to help one another, to be there for one another, and to make sure that together as a community, we get through the pandemic. So I'm so happy to be part of this initiative that is bringing together community members and bringing together the Indigenous community to, you know, really have a voice in these hard times. So I think that this project, Jiggle COVID-19, has, you know, really taking on that theme of community, and that's what we're hoping to achieve, is bring people together through our project. And I think from there we'll hear a little bit more about what is our project from Trevor.
Thank you, Levi. Ani waldasi nige gisku itlu istullo. Waldasi hey gisugu Eileen Brooks. Waldasi kiga nigama idlintu dijik nige gisku. Walali nige ni name la ilnuwe gadi delui demo migmagi la sa ilnuwe gadi la sa ilnu maamigo mo la maamigo mina aginu medumwe. Waldasi chilida migmagi. So hi, I love to speak in my first language, excuse me, being Mi'kmaq, and of course I'm going to translate into English. But what I noted was that I am honored and I am grateful to be here. And I know Stephen mentioned earlier about keeping our communities healthy and safe. Excuse me, I need water. And but it is so true. This is for the Indigenous communities and for non-Indigenous communities. But I also noted, that we are in Mi'kmaq. I know Elder Brooks did the acknowledgement, but we are in Mi'kmaq, the traditional, ancestral, and unceded Mi'kmaq territory, the land that we have never, ever gave up, the land that we have never surrendered to. So welcome. Yes, this is Mi'kmaq. So I am honored to share with you of the important project that we're part of. So Jiggle COVID is a campaign that shares information and messages to guide access to COVID-19 testing sites, health services, and other supports to help reduce the spread of COVID-19 in Indigenous communities across Mi'kmaq. And it's offering social media contests and awareness campaigns and interviews with elders and other knowledge keepers. We have interviewed our elders, how we changed our ceremony to beat this illness, how this illness disrupted everything for all, not just in the Indigenous communities, but for all. But since this, and I love how Levi pointed out about community, because I grew up in a strong community of Eskazoni. It was a beautiful community, Eskazoni. We're a tight-knit community, and even those surrounding communities in Cape Breton or Unimagi, which means land of the fog. So there's 5 First Nations or Indigenous communities in Cape Breton, and then there's 8 in the mainland. So that's 13 in total. But we're all close-knit. I know Eskazoni is a close-knit family, but those other 4, given a total of 5, we're all so tight. And then, of course, those other 8. So these 13 communities were so connected. So with this illness, it disrupted, yes, our ceremonies, our sweat lodges, our smudges, our Sundance ceremonies, Mawiomis or gatherings. So this is an honor to hear the drumming today. And you're also going to see my other relative, Taya, she's going to be dancing as well. So it's good to see that. But anyway, I'll just keep going and going, and I'll let Levi to finish the rest. But Willalio, thank you so much to DGH and to the generous donation through the RBC. So thank you very much. This initiative, this project, which is very important, wouldn't have been possible without you. So Willalio.
So in addition to the social media campaigns that we've been running, we are also providing little packages of personal protective equipment for some various Indigenous organizations throughout Halifax and around. And we've also been assembling some resources, some great brochures that we brought here today to pass out to some community members. And so we actually ran our first social media campaign last month, and it was a great success. We had a lot of people submit, and we had some really great content that was shared from all over the province. So we were really happy with the turnout, and our winners of that contest was Anastasia and Selena. So shout out to them for submitting their amazing videos. And, you know, a lot of these videos, they talked about following public health recommendations like washing your hands often and wearing a mask and practicing social distancing. And we're running some more contests now. So if any of you have social media, which I'm sure most of you do, be sure to follow us on Twitter, Facebook, Instagram at Jigalai COVID-19 online. They're all the same handle. And yes, Trevor, did you want to talk about the drummers and the socially distant? How we kind of changed for that?
Yeah. So just to end this off, my cousin right now, like even with Elder Brooks, with the changing of the ceremonies, we used to have like say up to 20 people in a sweat lodge. But after speaking with the elders from our communities that do ceremonies such as the sweat lodges, they have cut their numbers in half, say from 20 to 10. And Mrs. Brooks also changed the way how we pass food around in the sweat lodge. If you ever attended a sweat lodge ceremony, there's berries that we would pass around and would eat. But now you would have like individual cups that would be passed around in the sweat lodge, and of course social distancing is strongly encouraged. Much like the drum group, I know today we have the drum here today with one large drum group, but before the restrictions were even lifted, they changed their ceremonies even by having one hand drum. So there's about 6 drum groups right now, people up there, or out here, I mean, sorry, and each of them would have their own drum. So we have changed our drumming and our gatherings that way as well. But we certainly have changed our ceremonies to, again, just to combat this illness from spreading further into our communities. Willalin, thank you.
And so I just want to say we are so grateful for the RBC Foundation for making this campaign possible and supporting us to deliver such an innovative initiative that advances Indigenous centric strategies to prevent the spread of COVID-19. And thank you to the Dartmouth General Hospital Foundation as well, and to all of you folks who came and listened to us today. Thank you very much. And that is it.
Thank you very much. What a great, amazing program. Well done. I'm following them on Twitter, so it's really, I encourage you to follow these guys on Twitter. It's really impactful. Let me take the mask off now. I see Joseph Diab and Violet Diab have joined. Stand up, Joe and Violet, give a wave from Baker Drive Developments. Joe and Violet are great supporters of the Dartmouth General Hospital Foundation, and Joe is a member of our board of directors. So thank you for joining us today and for all that your help is achieving. That's wonderful. I'd like to now move on to our next performance. We are incredibly lucky here today to be joined by a spoken word artist from North Preston, Cinnamon Downey. Cinnamon is here to perform an original piece entitled Arise. She composed this to inspire the next generation of African Nova Scotian healthcare professionals. So let's enjoy. Cinnamon.
It's very hot. How's everyone doing this morning? It's good. That's good. So I just want to thank the Joanna from the Dartmouth General Foundation for asking me to do this poem, and I hope you guys enjoy it. Okay. Enter. Your opportunities await you. What's your next move? I say blast through the atmosphere of fear. The time to shine your brightness is here. Take charge of your future like a spear. Tap into that inner greatness. Greatness I see within. Put that beautiful creative mind to the test. I believe that if you believe, you will achieve great success. Awaken that God-given potential. You are a child of the universe. You belong here, and you best not let nobody tell you differently. Like Maya said, be like air, my child, and arise. Don't you know that we come from a strong, powerful, resilient people, a people so powerful that no matter the troubled waters they face, they survived and they thrived. No matter the stumbling blocks they may place in your path, you are your ancestors' wildest dreams. You are young, gifted, and Black, blessed and highly favored.
Wow, that's incredible. Well done. So inspirational for our healthcare teams as well. So thank you so much, Cinnamon, for your amazing work of art. That's incredible. Thank you. We're now joined by Sharon Davis Murdoch, representing the Plans Initiative at the Dartmouth General Hospital and Foundation. Sharon is a member of our board of directors of the Dartmouth General Hospital Foundation. She's also the co-president of the Health Association of African Canadians, HAC. Plans, which stands for Promoting Leadership in Health for African Nova Scotians, in partnership with the Dartmouth General Hospital, RBC, Dalhousie University's Global Health Office, and the Foundation, will provide health career preparation and support to youth from African Nova Scotian communities. Welcome, Sharon. Let me wipe this down first. Yeah. There you go.
Good morning, everyone. I have foggy glasses, so I'm so glad to be able to take my mask off for just a minute so I can actually see you all. Hello, everyone. I'm so proud to be here today as Secretary of the Dartmouth General Hospital Foundation's Board of Directors, as co-president of the Health Association of African Canadians, and also as a founding member of the Plans Advisory Board. I am honored to be involved in this new initiative that will grow the next generation of African, Nova Scotian, and Canadian healthcare professionals. At the Dartmouth General Hospital, our priority is to provide equitable, high quality, and culturally competent care to everyone. In order to do this, all members of our community must see themselves reflected in the healthcare professionals who serve them. I'd like to thank RBC Foundation for making this initiative possible, and for our partners at Dalhousie University's Global Health Office, who are coming together with the foundation and our DGH health teams to ensure its success. You are giving 10 high school students the opportunity of a lifetime. These lucky students will explore various health professions, receive mentorship, engage in hands-on activities, and complete a research project this fall. This experience at a young age will build a solid foundation for a promising career and increase the underrepresentation of African Nova Scotians in the health professions. Of course, the pandemic has presented some interesting challenges when planning the inaugural year of the Plans Initiative at Dartmouth General. However, our team is prepared to pivot to offering a virtual learning experience with one-on-one mentorship support from African Nova Scotian and African Canadian health professionals who work right here at the Dartmouth General Hospital. Students will also have the added benefits of participating in RBC future launch workshops, including personal branding and financial literacy to prepare them for the jobs of tomorrow. I am eager to see this initiative implemented, and we look forward to witnessing the career growth of these promising young people, and hopefully one day seeing them employed at the Dartmouth General Hospital. Thank you so much, all of you, for being here. Thank you.
Thank you so much, Sharon. That was amazing. What a great program for the next generation, encouraging the next generation of healthcare leaders and staff. Okay, great. So let me just, I'd like to now invite Dr. Nancy Ross to the podium. Dr. Ross is an assistant professor at Dalhousie University's School of Social Work and is a lead researcher for the Culturally Responsive Healthcare to Reduce Gender-Based Violence research initiative at Dalhousie. This project was funded by the Nova Scotia COVID-19 Health Research Coalition. Over the Easter weekend, thinking back, Nancy, to the Easter weekend, you were busy generating some research proposal that ultimately was successfully funded thanks to this Nova Scotia Research COVID-19 Health Research Coalition. The Dartmouth General Hospital Foundation is proud to be a founding member of the Nova Scotia COVID-19 Health Research Coalition. And thanks to RBC's support, we were able to help fully fund this project that we're about to hear from. This research project is one of many projects we're funded and are now underway. And we're looking forward to hearing about the progress and the impact that will happen. So Nancy. Yeah.
Hello, everyone. Before I begin, I'd like to say how pleased I am that our student that's involved in this research project is here with me on this podium, and her name is Divine Beve, and she's going to share in sharing a little bit about our project. Which I think is, we have notes that are here somewhere. Just one moment, please. I'm proud to be here today as a member of the Dalhousie research team, leading a study called Culturally Responsive Healthcare to Reduce Gender-Based Violence. I'm delighted that Divine Beve is here, and as I mentioned, one of the social work students working on the project. Our research was made possible from funding from the Nova Scotia COVID-19 Health Research Coalition. The coalition is a collaborative partnership that developed a collective COVID-19 response strategy in cooperation with the Nova Scotia Health Authority, Research and Innovation, Dalhousie University, Dalhousie Medical Research Foundation, the QE2 Health Sciences Center, the IWK Foundation, the IWK Health Center, the Dartmouth General Hospital Foundation, and Research Nova Scotia. So these partners have collectively committed $1.5 million to Nova Scotia research community. This research effort will inform the best COVID-19 practices and support healthcare decision-making and planning that benefits the people of Nova Scotia. When my research team and I first heard about the call for proposals from the coalition in April, we knew we had a unique opportunity to act quickly to address the disproportionate impacts of the pandemic on African Nova Scotians who experience family violence. Pandemics create times of uncertainty that are linked to a myriad of risk factors for increased violence against women and girls. The impact of social and health inequities experienced by African Nova Scotian communities are compounded by the pandemic, leaving them particularly vulnerable from both the health services and social outcome standpoint, with potentially dire social consequences. At a time when social policies are encouraging the general population stay home, our project aims to heighten awareness about the increased vulnerability of African Nova Scotians who experience family violence and bring attention to protective measures to reduce risk and promote social equity. In our original research grant application, we included a plan to create a short film to convey key principles of culturally informed health system delivery specific to the African Nova Scotian community. We were thrilled to be awarded a grant of $45,000 from the coalition to complete our proposed research project. However, we had to make the difficult decision not to produce the video due to the budgetary limitations. So we'd like to thank RBC Foundation for their generous gift to this research project. And to be honest, it was a complete surprise to me and my research team, and we were overjoyed to learn the news of the RBC's foundation support.
Thanks for your generosity. We'll be able to produce a video that convey adverse childhood experience, inform health system delivery specific to the African Nova Scotia community that will incorporate it into an educational model for healthcare workers. Our team is looking forward to sharing the findings of our research and the completed educational video with you all. We are hopeful that this work will contribute to the development of healthcare systems that are responsive to the impact of race, racism, adverse childhood experience, and trauma. I am pleased to be working in partnership with the Association of Black Social Workers on this project. On behalf of myself and my research team, thank you for being here today.
Thank you very much.
Wow, what an amazing initiative. We're really looking forward to the results of this research and now the video, thanks to RBC and seeing that video come to life. I'm now pleased to welcome Heather Pettiboliver, a clinical nurse educator here at the Dartmouth General. Heather works in our emergency department, and she will talk about some new emergency room mental health training that has been made possible thanks to RBC.
Thank you, Steve. Good morning, everyone. As Steve said, my name is Heather Pettiboliver. I'm the clinical nurse educator here at the Dartmouth General Emergency Department, and I've been a staff member at the facility for over 20 years, but I'm not really that old. And I am delighted to be involved in this new initiative that will engage our frontline healthcare providers in supporting the demand for mental health and addictions care. The global pandemic continues to highlight the growing need for quality mental health and addiction support. Construction continues. This initiative will focus on the well-being and psychological safety for both the patients who present to the emergency department requiring mental health and addiction support, but also the staff who provide the care for them. We will embed the principles of trauma-informed care into our training: safety, choice, collaboration, trustworthiness, and empowerment. We will also develop a program for peer support to support the staff who are caring for these patients. In order to provide quality care for patients who are experiencing mental health and addictions issues in the emergency department, frontline healthcare providers need ongoing knowledge and training. I'm grateful to the RBC Foundation for investing in our professional development of our team. This training will ultimately result in improved patient care. I look forward to sharing the experiences of our team as we journey through this training. We take pride in continuous learning and innovation here at the Dartmouth General, and I'm extremely appreciative of the support from the RBC Foundation as we endeavor in this journey. Thank you to all of you for joining us today.
Thank you very much, Heather. That's great work that's happening in the Dartmouth General Hospital emergency room, and mental health is such a key part of this pandemic, and we're so thankful for the work you're doing, and thanks to RBC. So without further ado, it's my pleasure now to introduce Chris Ronald, the Regional President of RBC, to join us at the podium. RBC's support has made a transformational impact, as we just heard, and we can't thank RBC enough for your transformational gift and support. Good thing we have lots of this material here. Thanks, Chris.
Good afternoon, everyone. Elder Eileen Brooks, hospital staff and guests. And thanks so much, Steve, for your wiping down of the podium, and also for the kind introduction, but also for organizing this event. I'm always happy to follow your COVID-19 restrictions that are in place, because as we know, they're working here, certainly in Nova Scotia and Halifax. However, I will admit, it's just so nice to be able to see people in person and interact with you. So I'm glad to be here with many of you today in a safe and physically distanced way. I'd say spending time with people is probably the thing that I've missed the most since the pandemic struck. And a huge thanks to everyone who came out today to celebrate our gift with the hospital. 2 years ago, I picked up my family and moved from Toronto to Halifax. And not only was it one of the biggest decisions of my life, I think it's been one of the best. And there are a few things that you look for when you're moving. And the first thing is the job itself. And I'm so fortunate that I work with the most talented team that I've ever worked with in 30 plus years at the bank, and that is a long time. And several of them are here today, and I just want to call out Lisa McDonald, Bill Mackay, Laurie Smith, David Gilbertson, and there's and also Laurie, to your team who've helped put this together. So I am very privileged to work with an awesome RBC team. You also choose the people, or you think about the people that you're coming to, and my wife Lindsay and I were so warmly welcomed by so many of you who've become friends. Again, some of you who are here today, John Fitzpatrick and your wife Heather, and I've had the opportunity to enjoy a number of meals with you, and you were so kind to our family very early on. And I had dinner when we arrived with Joe. We were hoping to meet with you at the Festival of Trees, but instead we had the pleasure of your family as well, and your son and daughter-in-law at the Festival of Trees, and that was a pleasure. Culture. This province and the city have such a deep and rich cultural fabric that's unmatched anywhere. And we heard a little bit today with the performances by Cinnamon, the Iron Ties, and just being a few examples. And I was really touched by the performances. I thought they were exceptional. The singing and the drumming and the spoken word means a lot. And I think it is something that I, being relatively new 2 years in Nova Scotia, there's a lot more for me to learn. But I find it very moving. And finally, my wife, Lindsay, has MS. So having access to quality healthcare was really a non-negotiable when we thought about moving to Halifax, Nova Scotia. And I think some cities are fortunate to have one good hospital. HRM has 3 world-class hospitals, with the Dartmouth General being just one of them. And I remember the first time that I visited the Dartmouth General, and it was just before the new wing opened, with Fred Smithers, Todd Howlett, John Fitzpatrick, and Steve, you gave us a tour. I knew right away that this hospital was very unique. It has the infrastructure and offerings usually found only in large metropolitan areas: leading edge diagnostic equipment, the Fred Smithers Center for Orthopedic Care, and a new OR suite that I've never seen before. But has the heart of a small town facility. The minute you walk through the doors, you feel it. It's a sense of belonging, a sense of caring, a sense of community that sometimes is hard to find in large cities. Deciding to partner with a hospital was the easy part. We wanted to partner with the Dartmouth General. We sat down with Stephen more than a year ago. He shared their plans about transforming access to care. It was clear right away that we shared similar values and goals, like diversity and inclusion, creating environments that are welcoming and respectful for everyone, collaboration, ensuring our workforce is reflective of the communities that we serve, and seeing mental well-being as a critical component of overall health, to name a few. The hard part was deciding which program we wanted to lean into, because they were all so great. Supporting our Black communities is a priority for us, so we are very interested in the PLANS program. We've been investing in mental health programming for over 10 years, so the frontline mental health training made incredibly good sense. And when faced with the changing priorities that we face in this pandemic, we saw an opportunity to continue to support our Indigenous communities with JIGLI COVID-19. At the end of the day, all 5 components of the Transforming Access to Care program are critically important to us, so we're going to support all 5. So to Stephen and the team at the Dartmouth General, thank you for providing us with this opportunity to be part of something that we believe is very meaningful. We can't wait to see the significant difference these programs will now make in the years to come. And so now I think we'd like to present the check. Just take your mask off with a. Yes, because we're physically distant. Yeah. Thank you.
Wow. Thank you so much, Chris. Thank you so much. We really appreciate your support. Now that is strategic philanthropy. That is very smart, a very smart gift that is delivering impact in 5 areas around diversity and helping to make our hospital continuing to grow and be one of the best in not just Nova Scotia, but our goal is to really thrive nationally. I want to thank Lori and Chrissy as well. You were such a big part of this gift as well. So thank you so much. Big round of applause for Lori Smith and Chrissy Arbuckle. And also to the rest of the RBC team that's here today, and also those who are watching via live stream. We really appreciate your support. It's programs like these that we've just heard about today that allows everyone in the community to be healthy and safe. And it's really programs like this that are enabling us to be here in person today as well as part of the Atlantic Bubble. So again, congratulations and kudos on a very smart and strategic gift. And I remember that day we did the tour as well. So I'm equally impressed with the state-of-the-art facilities, but also, as you said, that juxtaposition with community is a very special thing we have here at Dartmouth General. So I want to extend a huge thank you to our speakers today and our performers. So honored. So what a great, amazing event. We want to be sure we hear again from the Iron Tide performers. Thank you very much. Wow, incredible. One more song. Okay. They're hearing you in Ottawa right now, I think. Great job. One more song, and then we'll have time for a photo with all of the speakers at the podium. Thanks. Well done. Amazing. So powerful. Great. I'm sure our patients have been hearing this as well and enjoying this. So thank you so much. Well done. The Iron Tide Singers, everyone. Round of applause again. Okay, I'd ask the speakers to come up for a photo, and I think there's some members of the media here as well. So our speakers are available for any comments if required. Thanks everyone for coming, and have a great and safe day. Take care.